Hey everyone, we've got another specimen today. This is number 253 in our collection. We'll do kind of a sneak peek or teaser into what the phenotypic feature of this specimen is. And here, when we look from the left ventricular aspect, we do find that there is a ventricular septal defect, and there does appear to be fibrous continuity between the tricuspid and mitral valves across this intraventricular septal defect, consistent with a perimembranous ventricular septal defect. So now let's start from the beginning. The heart would have sat in the chest like this, anterior surface towards the screen, posterior surface towards the turntable, head or superior here, legs are inferior here, left over here, right over here. Let's do what we normally do, which is try to identify the right atrial appendage, at least externally. And here is an atrial appendage that's triangular, broad-based, or pyramidal in shape, consistent with, at least externally, what a right atrial appendage would look like. So why don't we go ahead and open up the heart there. And when we do find that there are pectinate muscles that spill outside the confines of this appendage, consistent with the morphologic right atrium. We can immediately identify the oval fossa, and we do see that there in fact is a little communication between the atria here. So there is an oval fossa atrial septal defect. And then here is the mouth of the coronary sinus. And then here is the tendon of Totaro. And so at the apex of the triangle formed by the mouth of the coronary sinus, the tendon of Totaro, and the right-sided atrioventricular groove, aka the triangle of Koch, is where we'd expect the atrioventricular node to live in this heart. Now, when we look at this right-sided atrioventricular junction, we find that it's guarded by a valve that has 3 leaflets, 1, 2, 3. It's kind of faint, they're hard to see here. There are direct connections to the ventricular septum, consistent with a morphologic tricuspid valve. And we see that the ventricle that this opens up into has coarse trabeculations and a septomarginal trabeculation, aka a moderator band, consistent with a morphologic right ventricle. Now, when we look at this heart, we also notice that there is in fact a ventricular septal defect right back here. So let's try to find this defect and demonstrate it a little better from the right-hand side, which might be difficult because this defect does live well behind the tricuspid valve. So you can kind of see it here from the right, but it's not the simplest one to demonstrate. So here is a defect in the ventricular septum, and we can see that it appears that the tricuspid valve and mitral valve have some continuity across this defect, consistent with a central perimembranous ventricular septal defect. Here's the posterior aspect of the heart, and we'll go ahead and open up the other atrium. When we do that, we find an atrium that's smooth-walled, consistent with a morphologic left atrium. Here's the backside of the oval fossa. Here's the left atrial appendage, and this is where the left atrial appendage opens into the left atrium. Note that all its pectinate muscles are confined to the appendage itself, consistent with the morphologic left atrium. Here's the left atrioventricular junction. It's guarded by an atrioventricular valve that does have a round or oval annulus. This valve has 2 leaflets, 1, 2, and it has no direct connections to the ventricular septum here, consistent with a morphologic mitral valve. Now, when we get to the ventricle itself, here is a ventricle with fine crisscross trabeculations, consistent with the morphologic left ventricle. And now here is that ventricular septal defect that we saw from the right, can be appreciated more from the left here. And we can appreciate that there is in fact fibrous continuity between the tricuspid valve leaflet and the mitral valve across this defect. And here is that tricuspid valve tissue, and here's that mitral valve tissue. So this is all consistent with a central perimembranous ventricular septal defect. Now there also appears to be a second ventricular septal defect here, which is in the trabecular portion of the ventricle. So let's go back to the right ventricle and see if we can find that. And now that we know it's there, it's a little easier to find, and that's right here. We can see that, in fact, it is in the trabecular area of the right ventricle. It's completely surrounded by muscles, so this is a muscular trabecular ventricular septal defect. So this heart has two ventricular septal defects, a muscular ventricular septal defect here, and a central perimembranous ventricular septal defect here. Now, when we go to the left ventricular outflow tract, we find an arterial valve with 3 leaflets, 1, 2, 3, 3 sinuses. We can see the right coronary artery arising from here, all consistent with a morphologic aortic valve. Note that, as we expect, there is fibrous continuity between the aortic valve and the mitral valve as well. So there is aortomitral continuity in addition to the tricuspid mitral continuity across this perimembranous ventricular septal defect. Here's the ascending aorta, here's a transverse arch up here, and then the descending aorta here. So an interesting and unique example of a heart with both a muscular trabecular VSD and a perimembranous ventricular septal defect.